Hi, I am Rosanna Elizondo, and today I'm going to be doing my presentation on the unspoken demographic, the hidden emotional, psychological, and developmental effects of pornography addiction, specifically in women. Um, Today, we're going to discuss population that has remained largely invisible in both public discourse and clinical conversations. Women struggling with problematic pornography use and pornography addiction. So, we're going to dive right in today and we're going to discuss some of these hidden areas and this demographic that is not as often talked about when discussing pornography addiction. When pornography addiction is discussed, the image that often comes to mind is predictable. We imagine an adolescent boy, a man in secrecy, compulsive late night internet use, and explicit visual material. Repetitive behavior reinforcement. What we do not often picture is women. Women are consuming pornography. Women are entitled to express and have an outlet for emotional and sexual needs and desires. But what happens when those desires and needs and need for emotional intimacy becomes addictive behavior that disrupts productive activity and life? Women are developing compulsive relationships with erotic material. Women are experiencing shame, relational distress, emotional dependency, and distorted expectations surrounding intimacy. And in some cases, symptoms consist with behavioral addiction frameworks. And that's a little bit of what we're going to be exploring today. But because female pornography consumption often presents differently than male consumption, it frequently goes unrecognized. Not only by clinicians, but by women themselves. Today, I want to explore the hidden demographic of female pornography addiction through 5 lenses: history, gendered presentation, neuropsychological and emotional impact, developmental implications, and relational consequences. Because if we continue to conceptualize pornography addiction exclusively through a male lens, we will continue missing a significant portion of those affected. So, let's jump into some of the historical context. Erotic imagery dates back thousands of years. Ancient Roman frescoes in Pompeii depicted explicit sexual acts. Erotic carvings existed amongst multiple civilizations. Sexual representations in media has always existed in some form. What changed was accessibility. For much modern history, pornography was difficult to access, socially stigmatized, and overwhelmingly marketed towards men. This commercialization of pornography accelerated through print media, magazines like Playboy, VHS tapes, DVDs, and eventually internet-based streaming. Historically, pornography accelerated through print media, and pornography was built around the male consumer model: visual stimulation, rapid gratification, explicit novelty, and solitary use. Then the digital age transformed everything. Cooper's well-known triple engine describes pornography as explosive expansion through 3 mechanisms: accessibility, affordability, and the ability to be anonymous. Today, pornography is no longer something one seeks out of obscure spaces. It exists in pockets such as telephones, tablets, streaming devices, social media algorithms, and increasingly, it exists disguised. Because female-oriented pornography does not look like traditional pornography at all. One of the greatest clinical mistakes we can make is assuming that female pornography addiction should look like male pornography addiction. And it often doesn't. Male pornography historically has been characterized by visually explicit media consumption, often reinforced through masturbation, novelty seeking, and increasingly escalated explicit material. Women, however, often consume erotic material through more emotionally and immersive channels. And this more looks like erotic literature, romance based pornography, fan fiction, serialized fantasy erotica, parasocial media attachments, dark romance fiction, erotic streaming narratives. And yes, mainstream media. Let's consider 50 Shades of Grey. This franchise became a cultural phenomenon, not because women suddenly developed an interest in explicit content, but because erotic fantasy was packaged in a socially acceptable emotional narrative. It included power dynamics, anticipation, obsession, fantasy, rescue, emotional longing, and rational intensity. The eroticism was embedded in the attachment fantasy. The same can be said for medias like Bridgerton, 365 Days, Outlander, just to list a few. These forms of consumption may appear more socially acceptable because they are emotionally framed. But emotional packaging does not eliminate addictive reinforcement. In fact, for some women, it may intensify it. Because what is being reinforced is not merely sexual arousal, but it's fantasy, emotional escape, attachment simulation, idealized connection, and the distinction matters tremendously. Now, I want us to acknowledge an important academic caveat. Some researchers prefer terms as compulsive sexual behavior disorder, problematic pornography use, compulsive sexual media consumption. However, behavior addiction frameworks remain useful when we observe the hallmark addiction features. What are those? So, compulsive engagement, loss of control, escalation, continued use despite consequences, emotional dependency, withdrawal like distress, and interference with functioning in day-to-day responsibilities. When applying this framework to women, the presentation often differs. Women may not present with hours of explicit media and video consumption. Instead, addiction may look like compulsively reading erotic fiction until 3 a.m. in spite of having to be out at work at 7, repeatedly escaping into a fantasy-based sexual narratives during emotional distress, emotional dependency on specific fictional relationships, and obsessive consumption of romanticized sexual dominance content. Using erotic material as emotional anesthesia for loneliness, rejection, boredom, or relational dissatisfaction. That distinction is what's critical because clinicians trained to recognize only male pattern pornography addictions may completely miss female symptoms and presentations altogether. So let's jump over into the neuropsychological side of this. What happens in the brain? We've already discussed on how this looks different and how it presents different and how the consumption will differ from male-centered pornography addiction. But now let's look at how it's going to affect the female brain and the neuropsychological effects. Pornographic material activates the brain's reward system. Dopamine plays a central role in reinforcement learning, anticipation, motivation, and reward seeking. The brain is not responding merely to explicit content. It is responding to novelty, anticipation, emotional arousal, unpredictability, and reward expectation. Repeated exposure strengthens conditioned associations. Over time, cue reactivity development. Certain triggers begin automatically activating desire pathways. Stress, loneliness, conflict, boredom, nighttime isolation, emotional discomfort. For women, these pathways may involve both sexual arousal systems and attachment-based emotional reinforcement, meaning the addictive loop might not simply be stimulus, arousal, orgasm reinforcement, like we see in male-centered pornography addiction. Instead, it may look a little bit more like emotional discomfort, fantasy immersion, emotional soothing, sexual arousal, and then reinforcement. That is very different when we're putting together a psychological profile, when we're looking at addiction frameworks. And often it's harder to identify. Emerging literature suggests overlaps between problematic pornography use and behavioral addiction markers, including compulsivity, cravings, impaired control, and distress. Women may also experience escalation, but escalation might not always mean more explicit. Instead, escalation can mean darker fantasy themes, increasingly taboo relational dynamics, more immersive emotional dependency, more frequent use, and greater difficulty connecting with real life intimacy. Tolerance can become emotional just as much as it can become sexual. Ordinary relationships begin to feel insufficient compared to idealized fantasy structures. So, what are the emotional and psychological consequences of this? Women often who are immersive in erotic material as a coping mechanism for stress, loneliness, unmet attachment needs, escape, dysphoria, emotional numbing, to list a few, the immediate relief reinforces repetition, but the long-term cost can be significant. Shame is profound because female sexuality remains culturally policed in contradictory ways. Women are expected to be sexually empowered, but not too sexual. Open, but not excessive. Confident, but not compulsive. As a result, women experiencing pornography addiction frequently internalizes and intensifies the secrecy. That secrecy can fuel shame, emotional distress, drive further use, and the cycle continues, leading to anxiety, depressive symptoms, intrusive fantasy preoccupation, disassociation, emotional withdrawal, self-objectification, compulsive rumination, and reduced frustration tolerance. Fantasy becomes easier than authentic intimacy. And predictable erotic narratives become safer than emotionally vulnerable relationships. And eventually, reality may begin to feel emotionally flat by comparison. So, let's talk about the next portion of this and sexual functioning and satisfaction. So, internally, intimacy appears intact. Internally, arousal depends on fantasy substitution. This can create relational confusion. Partners may perceive emotional distance without understanding the origin. Women themselves might feel guilt, shame, or confusion about why authentic intimacy feels less compelling. Again, the issue is not simply explicit material. It is conditioned reward and expectation. This brings us to a major clinical concern. Why are women so often overlooked? Several reasons: gender stereotypes. Pornography addiction has been culturally masculinized. Clinicians often screen men, they rarely screen women. Even when women present with symptoms consistent with compulsive sexual media use, providers may conceptualize the issue differently. Second, shame. Women often don't disclose. Disclosure carries fear of judgment, labeling, and misunderstanding. Women who do not identify their behavior as problematic because their consumption appears socially acceptable. Beyond individual clinical cases, the issue has a broader social implications. We are raising a generation in which eroticized fantasy is normalized and promoted and emotionally packaged as empowerment. Yet empowerment and compulsive dependency are not synonyms. A behavior can be culturally normalized and still psychologically harmful. Social media has intensified comparison culture, hyper-curated intimacy is everywhere, and romantic obsession is aestheticized, emotionally volatile, but is glamorized. So, in closing, where does that leave us? Women have never been absent from pornography consumption. They have simply been overlooked. And perhaps one of the reasons that female addiction is often does not fit the narratives that we're trained to recognize. It may be quieter, more emotionally disguised, more socially acceptable, less visually explicit, and more attached driven, more hidden beneath the language of fantasy, romance, empowerment, and escapism. But hidden does not mean harmless. If our clinical frameworks remain rooted in exclusivity and male presentations, women will continue to suffer in silence. If our developmental conversations ignore emotionally immersive sexual media, younger generations will continue to internalize distorted relational templates. And if we fail to ask better questions, we will continue missing the very population most needed to be understood and heard. Now, does this mean that women should never consume sexually explicit material or have sexually pleasing material that they enjoy and use occasionally? Absolutely not. So, what we need to just remember that we talked about in the beginning of this conference, that we remembered the framework of when it starts to present as addictive framework and behaviors that become problematic, when it begins to disrupt emotional and relational and attachments in a healthy way, when it begins to disrupt daily lives and it causes more isolation, anxiety, and depressive episodes. So I'm going to give you guys a 5-question quiz to ask yourself of what you know about female pornography addiction. And I want you to see how much you know and how much you didn't know, especially after listening to this conference today. So I want you to just clear your mind, try to remove all of the stereotypes and stigmas that you know. And let's see how many of these that you know and which ones that you learned today. So 1, which one of the following best explains why female pornography addiction is often unrecognized in clinical and academic settings? A, women rarely consume sexually explicit material. B, female pornography often uses through the emotional immersive narrative based on content rather than traditional visual pornography. C, women experience no significant psychological consequences from pornography use. And D, female pornography addiction only occurs in adolescence. The correct answer is B. Female pornography use often presents through emotionally immersive or narrative-based content rather than traditional visual pornography. The second question. According to behavioral addiction frameworks, which of the following is considered a hallmark feature of problematic pornography addiction? A, occasional curiosity about sexual media. B, moral disagreement with pornography alone. C, compulsive use despite negative emotional or relational consequences. D, consumption limited to romantic fiction. Tick tock, tick tock. The answer is C, compulsive use despite negative emotional or relational consequences. Remember, it is okay to have media and material that is pleasurable and that adults can enjoy in a private and personal space and setting, but when it has negative emotional and relational consequences, when it becomes disruptive to our everyday routine and responsibilities, that's when we need to start applying the addiction framework to see if it is something that someone is enjoying on a personal level as a consenting adult, or has it now crossed the threshold into the addiction framework that has become disruptive, and now we will experience negative consequences. So 3, and our final question. How many problematic pornographic consumption affect female sexual functioning? A, it universally improves partnered intimacy. B, it may condition arousal to specific fantasy cues, leading to a decreased satisfaction in real-life intimacy. C, it eliminates emotional attachment needs. Or D, it has no measurable impact on sexual expectations. The answer is B. It may condition arousal to specific fantasy cues, leading to decreased satisfaction in real life intimacy. Thank you so much for joining me in my presentation today.